A quick warning, this week we're discussing a sensitive and possibly triggering topic about sexual assault. A few startling statistics. Someone in the United States is sexually assaulted every 68 seconds. 1 out of every 6 women and 1 out of every 33 men have experienced an attempted or completed rape in their lifetime. And 55% of sexual assaults occur at or near a person's home. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. April is Sexual Assault Awareness Month. This week, we're talking about some misconceptions surrounding sexual assault, the Start by Believing campaign, and how St. Luke's clinical forensic program is educating the community and supporting patients after sexual assault. With me today is Jennifer Sonsiadek, the nurse manager for the clinical forensic program at St. Luke's Health System. Thank you so much for joining us.
Thanks for having me.
So, Jennifer, unfortunately, some misconceptions persist around sexual assault. Can you share what some of those misconceptions are?
I think one of the biggest misconceptions is that it's a stranger that commits these kinds of acts, or that it's a violent situation, or that weapons were utilized, and that's not the case. We know that it's somebody usually very well known to them or in a place where they already feel comfortable. And so while it's not a stranger, it winds up being someone in a committed relationship where one person is saying no, that they don't want to engage in that activity, or it could be friends going out to have drink after work, or it could be that they've met somebody on a dating app. So we know that perpetrators, they're not using weapons, but they are using psychological weapons where they've established a level of trust with somebody, and then they're using a kind of force or coercion or threats. Sometimes they're using the fact that drugs or alcohol has been either voluntary or involuntarily ingested to help facilitate an assault. The other thing is that it's not about what a person was wearing. It's not about what they were doing. It's not about what time they were out or if they were in an area that was unpopulated. If a person is saying no, verbally or non-verbally, and a person doesn't listen to that and perpetrates, that is sexual assault, sexual violence. We know that sometimes a person may not be able to consent if they're in terror or fear. They may not be able to consent if they've had some alcohol on board or drugs involved, or if they're asleep.
Now, if someone has been sexually assaulted, what should they know about the medical forensic exam?
The medical forensic exam can occur anytime after the assault. I think there's some misconceptions that if someone waits days or weeks, that there's nothing that can be done, and that's not the case. While it is true that DNA is perishable, and as time goes on, we have less of a chance of being able to collect that and preserve that, there are so many things that we can do to help support somebody who has endured something like this. And it may be taking down their disclosure and their narrative of what they've experienced. It may be that we are collecting their clothing and their bedding that they've maintained since the assault. So the important thing is that they respond to a hospital that has a SANE program so that they can receive those services and be connected to our community partners that can help with their healing and recovery.
So do all hospitals have a SANE program?
Most of the hospitals in the greater Kansas City area do have access to a SANE consult. However, St. Luke's does not limit the amount of time between the assault and the forensic exam.
Okay. Now, when a patient comes in for an evaluation after a sexual assault, a specialized forensic nurse works with them during their exam. Why is that important for a patient?
Well, a SANE is either a registered nurse or it can be an advanced practice nurse who has that specialized training to help provide care for both acute and long-term consequences of the violence that our patients have experienced. We also are able to provide fact testimony, which is the kind of care that we're providing, the evidence that we collected, the injuries that we noted on their body, as well as expert testimony. So that means that we are giving our expert opinion on what we witnessed during the examination process. So this is something that is integrated into the medical care that's provided to that patient when they present to the emergency department.
Okay. The Start by Believing campaign started several years ago to raise awareness for sexual assault victims across the country. Can you tell me about this national campaign?
Certainly. It started 7 years ago here in the greater Kansas City area, and it's aimed at providing education and support to our community to eradicate victim-blaming behavior so that people understand how to support a victim best through the process. It also helps with our community partners, the criminal justice process, and ultimately to make sure that these kinds of crimes are are handled appropriately and adjudicated. The ultimate mission of the Start by Believing campaign is the first response matters, and so when a person discloses, we want to make sure that that person is met with compassion, and so I believe you. That's the most powerful thing that you can say to a person is disclosing.
Absolutely. Now, how is St. Luke's a leader in supporting and caring for people impacted by sexual assault in the community?
Back in 1974, St. Luke's was the first private rape treatment center in the entire country. And since that time, we've expanded our services to all different kinds of violence and victimization and applying forensic care for them in connection to community resources. Additionally, our program provides education to our community, to law enforcement, first responders, lawmakers.
Now, is there anything else you'd like to add today?
Just that the public can be a weapon as well. So when we see gender norms, victim blaming, or rape culture, that can be really problematic for a person coming forward to disclose. So we want to make sure that the public understands that this is something that impacts all ages, all cultures, all socioeconomic groups, and so starting by believing can be the most powerful thing that you can do. It's important also to know that our nurses are available 24 hours a day, 7 days a week to help a person who's endured something like this to make sure they get what they need to heal and recover.
Okay, that's great. Well, thank you so much, Jennifer, for joining us.
Welcome. Thank you.
If you or a loved one is impacted by sexual assault, visit any St. Luke's emergency department or call 816-932-2000 for medical forensic care. Again, that's 816-932-2000. You can also stay up to date with all of the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.